Most Medicare drug plans have a coverage gap, also known as the donut hole. This means that there's a temporary limit on the cost that drug plans will cover for the cost of drugs. In 2019, once you and your drug plan have spent $3,820, this means that you are in the coverage gap. The amount that you and your drug plan have spent on covered drugs can also be known as the retail price of these drugs. This total retail cost amounting in $3,820 is also known as the initial coverage limit, and it's important to note that there's the possibility of the initial coverage limit changing each year. Not everyone will enter the donut hole. Furthermore, those who have Medicare and who have extra help paying Part D will not enter the donut hole. For those who don't have extra help for their Medicare Part D, it's important to understand the rules of what it means to be in the donut hole just in case you end up in it. The first rule is that if your plan has a deductible, you will be responsible for it first. Rule 2 is that once your deductible is met, or if you don't have a deductible, you will have to pay copays based on your particular plan for covered drugs. Once you are in the donut hole, you will pay 25% of the cost for name brand drugs and 37% of the cost for all generic drugs. In order to exit the donut hole, you will need to spend a total of $5,100 of out-of-pocket costs in order to reach the catastrophic phase. Once you reach the catastrophic phase, you would pay the greater amount of $3.40 for brand name drugs and $8.50 for all generic drugs, or you would pay a 5% coinsurance. Many of you won't reach the donut hole because most of the drugs prescribed to you will be considered generic, which will lower your costs. Some Medicare Advantage plans and prescription drug plans offer coverage for certain drugs through the donut hole. However, most of the time, the drugs covered would be considered generics. Some CSNP Medicare Advantage plans will offer coverage for select medications through the donut hole. For example, in many countries, there are health plans that will offer select coverage to eliminate or lessen the copay for insulin. This could be a lifesaver for those people who do depend on insulin, and this could keep them out of the hospital. For this reason, we recommend that you explore your options. We can help you do the research and ensure that you are covered for what you need the most.